Welcome to LCCAP Legacy, Decades of Dedication, the podcast that celebrates the incredible individuals who have shaped the heart and soul of the Lawrence County Community Action Partnership.
Each episode, we'll dive deep into the stories of those who have devoted their careers to making a difference, not just in our organization, but in the lives of the people we serve every day.
We'll uncover their journeys, explore the moments that inspire them, and highlight the lasting impact of their commitment to LCCAP's mission.
So whether you're here to learn, be inspired, or simply celebrate the amazing people who make LCCAP what it is, thank you for joining us.
This is LCCAP Legacy, Decades of Dedication.
Let's get started with today's guest.
You are now listening to LCCAP Legacy, Decades of Dedication. We are back for episode 11. And in the studio, of course, I have my wonderful co-hosts, Kim and Amber.
Good morning.
Good morning, everyone.
And as promised, we have another special guest in the studio here with us today. We have Jamie Black. And Jamie Black currently works as a health service assistant for Early Learning. And she has been with the company for the past 3 years. So Jamie, thank you so much for joining us in studio today.
Thank you for having me.
All right. So take us to the beginning. You started 3 years ago. What made you get involved with LCCAP?
So I was looking for a position helping the community. I had a friend that was friends with Kathy Presnar and had a job opening. And she said, I think you would be a really good fit for this role. So I applied with Stephanie and Missy, and I think everything just sounded like great. This is really what I wanted to do to get involved with the community. Then I started as a housing case manager. I did that for 2 years. My background is I was a medical assistant for about 12 years prior to that. So then whenever a position in the health office opened, I really thought that would be a great way to use some of that medical background, just to continue with the company.
And as a health service assistant, what does your daily work or what does that position entail?
So we work with all of the early learning. So that is Frew Mill, Ben Franklin, Elwood City, and then we have district sites as well in all the schools except for Union. So we basically do the health screenings. So that's collecting hearing, vision, height, weight, lead, and hemoglobin. So all of those to make sure that the kids are healthy. They're following up with their providers if they, have anything that needs to be further looked at. So that is a lot of the role. And then also working with the doctor's offices and dentist offices, making sure that they're up to date with all the screenings and health maintenance and stuff that they need to have. So do that as well. And then working with the family service workers who then work directly with the kiddos to, help if there's anything that needs, further referrals or anything like that, just helping support them in those situations.
So Jamie, you talked about like a typical work day in the health office. Can you tell us a little bit about working with the kiddos and what's most rewarding to you working with our early learners?
I think that with the kids that start early, with the childcare programs and then seeing them grow and seeing them then move on to whenever they go into kindergarten and just show how, ready they are with the all the supports and the learning and everything that they get with us. The teachers are great. Family service workers, like I said, are great. So we just really all work together to get them all ready for kindergarten. And it's just great to see them learn and grow.
So how do you stay organized managing all of the files and appointments and screenings and everything you have to do?
We do have, obviously like our electronic systems, running reports, just keeping ahead of everything, keeping, a schedule and figuring out, how to triage that, how to prioritize that. Like I said, making sure that like our screening deadlines and everything are met. And then if the kids need referrals, just following up with the doctor's offices. It's just kind of like every day is something different. And then just how we can, prioritize and like focus on the ones who really need the extra support, but then also, you don't want to not look at everybody as a whole. So.
And just looking at it, many people may not know all the different things that go into keeping a child healthy. So what are some things that most people don't realize about health services and early childhood education?
They really have regulations that they have to have for going to kindergarten. So we help the families, if they're not connected to a medical home, a dental home. Some of those things are really hard to get into. We do have a mobile dentist clinic coming up. So we have the mobile dentist that does come to our sites. So Ben Franklin, Frumill, and Elwood City. And kiddos who are enrolled into any of our programs are eligible for that. And like a lot of places around here don't see kids until they're 5. And the waiting lists and stuff for those are very long. So the families like to take advantage of that. That way they have that established. And then whenever they transition to kindergarten, they, have all those family, medical homes, dental homes established, and they can help transition that care. And then, connecting them for if they needed any further treatment or anything to who we can get them in with. And we kind of help, if we need to facilitate those conversations, support them in getting the the care and everything to help make sure that they're healthy and grown up strong.
And what is that education like for the parents? Because, sometimes you might think parents may know certain things, but they may not know. So how do you guys go about educating the parents on certain issues?
Sure. We have a family newsletter that goes out. All of our I don't want to say like rules, but everything that, is needed is all in a family handbook that we give them at the beginning of the year. So the family service workers go through all those and let them know like what our responsibility is and then what the family's responsibility is. And they can, take advantage of all the other services that are available in the agency. So we can connect them to healthy homes. If there's like some if we do their lead testing and it comes back high, then we can do that direct referral right to healthy homes. If they, need any other assistance with, housing, we can get them connected with the housing department. And then we also have our monthly family engagement nights, I guess, and they can come. We've had different community resources come in. Adagio did a vaccine clinic, so the parents could get flu shots if they, desired to do that. We had the state police come and do seatbelt checks or car seat checks. We have Michelle Scott does, help with the a little activity for food and teaching them how to, prepare healthy meals. And then we have giveaways with those as well. The health services always does something. We had our last one was helping. We actually had Treehouse speech and rehab come in and help to make sensory bins. So just all those different resources, and then we bring them in, and then the parents can earn points, and they can use those points to get little things from our family parent store. So laundry detergent or toilet paper, and some of those things that we sometimes don't really think of that are needed, but those things, are definitely important to folks who may not have the resources to get those. So we try to help connect them with, something just to help them get through. And then we do even helping with seniors, we do senior food distribution. So with the food bank. So there's just really so much that we do, and it doesn't like, I don't know. I don't even know if I can like describe everything because I'm still learning. And even like agency wide, it's just like we just do stuff and it just changes every day. Different things that we have, different partnerships that we have. Like I said, Treehouse, drug and alcohol. Yeah, so it's just really just a lot of resources and everything, anything that we can connect them with. So we really work. Family service workers work very hard to, help look at the whole family. I think Betsy's little saying is, the family has to do well for the kids to do well. So
That's so true.
yeah. So she, really kind of pushes us to make sure that we look at the whole family.
One really nice activity that you guys did in the health office was you guys made first aid kits with the kiddos at one of the learning family engagement nights. So that was really nice. The kids got to make their own kit and they put their own Band-Aids in there and their own gauze. So that was just something that, made them feel special and get to learn a little bit more about first aid.
Mm-hmm. Yeah, we try to include like the kids and the family. So whenever we do those activities, it's like a family activity and a kid activity. So it's really cool to try to, we're not just talking to the parents and we're not just, the kids are at school and we're teaching them different things at school, but then like we're pulling it together. So the parents can see what we're doing and then they can work with their kids to, help. And one of the times we talked about like safety, like if there's a fire, like making a plan to where you're going to meet. And I think sometimes parents don't think that that's like important, but you never know. So even with like the little kids what's a big tree that we can meet by or something. And, day to day, you might not think about that or you might not want to think about that. But whenever we're there to kind of like help facilitate the conversation that like these things happen and we can kind of do it in a non-scary way. So the families are able to have that like open communication to talk and starting the conversation.
And then, like you said, you get to grow with the kiddos. Up at Frumill, you go up to that location and our Ben Franklin and Elwood location, and you do dental activities. So you bring in little toothbrushes and you talk about our teeth. So then the kids get to brush their teeth on the little what would it be? Like a little diagram, like a tooth diagram.
It's like a little. We have a dragon. We have a
so cute
bear, I think it is, and then a dinosaur.
That.
So they open their mouth and they have like people teeth.
Their teeth, yes. So they get to learn how to brush their gums properly, and then you weigh them there, and they enjoy seeing you.
Yeah, definitely. They do. Well, my daughter is in one of the classrooms at Frumill, and it's funny because most of the other classrooms, it's Miss Jamie, and but her classroom, it's Nora's mom. Nora's mom's here. Yeah. So. Yeah, that's it's really fun. So she just likes whenever I come and visit and everything too. So it's kind of cool to, show her like whatever I get to do at work and everything and, interacting with her friends and stuff. I think it makes her feel a little bit more special.
Yeah. And the kids love it. Mm-hmm. And not only do you teach our families and our early learners, you do teach the staff too. We have a Narcan training coming up. Mm-hmm. If you want to talk a little bit about that, and then we do CPR trainings too.
Sure.
First
aid.
Alyssa
does our CPR and first aid trainings. So we have her and Kasera, and they, are employees that actually have gone on and got training to do that. So that's nice that, we all have different strengths and different things that we can do. And then tomorrow, actually, we have a bunch of people have been asking about Narcan training. So one of our contacts at Drug and Alcohol, we just asked if she would be willing to come in. And so the whole agency can come in and do some Narcan training and stuff. So that's really cool. We try to keep our, employees and stuff as well, keep them, what they're interested in and things that are relevant. So, yeah.
Could you share with us a memorable moment or story where you felt like your work, you've really made a difference?
Wow. There's like, I don't know if there's anything like really that stands out, it is just every day, just like a little smile. And even walking down the hallways and stuff, whenever they see you and they're like, hi, Miss Jamie, it's just, even if you're kind of like thinking that the day is going to be boring and mundane, just like any little thing like that, those little smiling faces are just really fun. And they make you feel like you're kind of an important person to them. So, that even if they, maybe had a bad day themselves, but they get to see you, then that's, it's really sweet.
You are relatively new in this role. So how can you see yourself growing within this role, and how can you see yourself applying new things to the health service department?
Sure. Yeah, we're always learning, always getting new trainings. Things are to change all the time. I mean, the whole agency, it's always like things always change. So there's always opportunities for if there's something new with a different program that we're going to be implementing, like what can the trainings be and stuff like that for that. And, I think Melinda's really good at, asking us to, hey, this is something new that's coming up. I think you would be good at that. Like, what do you think about this and stuff, and getting feedback and everything from us. So I really feel like we're all like seen and heard and like appreciated. So, they don't just kind of like, this is how it is and this is what we're doing. It's like, what do you think about this? Or like, how is this going to like impact you? Because there's maybe not something, that they think about. So it's, I don't know. I just feel like we all kind of, it's all of us, like all of our team and everything like really works together. And now that we have like nutrition, family services, and health services all kind of together, we really work, closely with it. And then it's nice to have, somebody else who's looking at a different perspective. So yeah, we just get trainings and look around and see what other agencies and stuff have stuff going on. And even if you don't think that it's going to be, relevant right now, you can always like, think back on like something that you did and you're like, oh yeah, like that makes sense, or that makes me feel like more comfortable with taking on something new.
So we all have stressful days here and there. How do you handle stress day to day? Is there any techniques you use?
Like some of the techniques that they teach us to help with like the kids, it's like taking a deep breath, taking a walk. It sounds like kind of like silly, but there's even like brain breaks and stuff like that like, we share with our teachers, or the teachers do with the kids. And, even with my daughter, like, she sometimes will, and she'll be like, just breathe. So you don't really
just
realize.
Do a bubble breath.
Yes, the bubble breath and like things like that. So like conscious discipline is, what all the teachers and everything go through. And it's like really silly, like watching some of this stuff. But whenever you're stressed out, like even if it's silly and it makes you laugh. So at least get your mind, your mood to change. So.
And laughter's the medicine to everything.
Right.
So.
Is there anything in particular that you're excited to accomplish this year?
I mean, I think the Narcan training is really cool. Us offering that. We definitely have offered it to different departments before, but this is like the first time that we're doing it like all agency wise. So I think that's kind of cool, because then like I was looking at all the signups and looking at all the different departments that are coming, and some of those folks might have heard of each other, or they might not, but now they get to come together and do that together. And it's not so, just with their little department. We're, again, just showing how many people out there like make the difference, make this whole little agency world go round.
And, compared to other guests that we've had onto the podcast, I would say that you're one of our newer employees here. But one of the themes of the podcast is legacy. So looking forth into the future, what legacy or impact are you hoping to leave on LCCAP?
I just think that the wanting to always learn and grow and not only for yourself, but how can that help with your coworkers, with your clients, I think is really important. So if at the point that you don't want to grow, that's like the point where, it just becomes a job and not really, a adventure. I mean, I definitely think this is an adventure. I mean, there's so many folks. I have already found another place where I think I feel a little bit more comfortable. It's just more of like my background in this agency. And I just get amazed every day, like I said before, like how much we do. So I think that it's never boring. It's never boring.
That's right. There's always a new program coming up or a new service or new employees. And yeah, there's so much that we do and to grow and learn from each other and to share that with the community.
Mm-hmm.
All right. Well, we're going to go ahead and wrap up the personal questions, and we're going to make our way to the quick fire round. And how that works is we're going to ask you a series of questions, and you're just going to answer with the first thing that comes to your mind. And Kim and Amber are going to go ahead and ask you questions. If you want to start out today, Kim.
Oh, sure. Yes, I would love to. So Easter is upon us. Can you talk about, Jamie, maybe some Easter traditions that you do at home that you have with your family that you'd like to talk about?
Sure. So my mother-in-law always sets up an Easter egg hunt. So the kids are all different ages. So my oldest is 21 and my youngest is 4. And then there's my nieces are in that group too. So they're all girls. So we have 7 little girls who run around and try to find Easter eggs, and she has them set up in different colors, and it's tries to make it harder for like the older ones, of course. So we have counted our Easter eggs and been short, and we have found Easter eggs months later.
It's always the best.
In the wood pile and like things like that. So yeah, that's really fun.
I love that. That sounds like lots of fun.
Uh-huh.
So if you could trade jobs with anyone at LCCAP for a day, who would you want to trade with?
Oh boy. Geez. I think for a day, just for a day.
Just for a day.
I'd probably like to be with the babies for a day, just to like snuggle them and smell them and whatever. Hold them and look at them, and they're so smiley and happy. But I don't know if I could do that every day. I just wouldn't want them to cry.
Just one day of a snuggle
just
day would
one
be
day.
good.
Yeah,
Rocking them.
it just makes me so sad whenever they cry, and sometimes I miss that little cry, but.
Yeah, Miss Lansdowne, we were at our breakfast with the Easter Bunny event that we held this past Saturday up at the Frumo location. And I held her baby, and it was so nice to hold him. He's 6 months, and he's just so sweet. And I know that feeling.
Yeah.
Yeah, they grow too fast.
Yeah, we did our, we're in the middle of our growth assessments, and oh my gosh, they're so cute. You just like, okay, everybody needs to get together and take their shoes off, and they just like, they get this little group and they just go and they just like love it. Like it's so fun. So just seeing their little smiling faces is really fun. But yeah, I wouldn't, I don't know if I could do the crying and the boo-boos.
Jamie, what's a favorite movie of yours that you'd like to share with us and our listeners?
Oh, goodness. So my daughter loves all the Despicable Me movies. So I like to watch those and like laugh with her and everything. Yeah, I always try to get her to watch like some of the more like Disney classics. Like, hey, let's watch
Lady and the
Cinderella.
Tramp.
Yes. Yes. And she's like Despicable Me, and she like knows all the words and everything. So watching movies with them is with the kids and stuff is always fun.
So when you were a kid, what was your favorite TV show or cartoon growing up?
Probably like Rugrats or something.
That's a good one.
Yeah, that is a good one.
Angelica, right? Was that her?
Yes.
Yes.
Mm-hmm.
That reminds me of Nora. She's so like bossy. But yeah, so I think it's on one of the subscription channels. So I tried to get my daughter to watch it and she was like, what is this craziness?
You have to have her watch the one where they go to Paris.
Yes.
That's my favorite one.
The orange VHS tapes.
Yes.
Oh my gosh. Yes, for sure.
We're showing our ages now.
Yes, we are. Well, it's funny. We're talking about this the other day. Ella and I were watching TV, and Step by Step season 1, episode 1 was on, and I was like, "Oh my goodness!" So I watched it, and she actually did too. I was surprised.
Aww.
But yeah, that used to be on TGIF.
Yes.
Yeah, Boy Meets World, Step by Step,
gosh,
all the good ones.
So if you could instantly master one skill, what would it be?
At work or at home or
Anything you want.
I'd probably want to sing better. I'm not shy about singing. I like to sing into my steering wheel microphone, and my kids get so annoyed. But yeah, I think I could probably do that a little bit better.
And if you had to describe your journey here at LCCAP in one word so far, what would that be?
Is ever changing one word?
It works.
It is
It's like a
hyphenated.
hyphenated word. Ever changing. I mean, just everything from the beginning has been, like I said, like, I think you would be good at this. Why don't you try to, try this out and stuff? So, yeah, it's never, ever, ever boring.
Well, thank you so much for sharing your journey with us here today, Jamie. We greatly appreciate it.
Thank you so much for having me.
And you did a fantastic job. When you first came to the studio, you were a little nervous, but you did great.
Extremely nervous.
It was that practicing on the steering wheel with the microphone.
Yes, you know what? That's true. It's like right here,
You're a natural.
Yes. Alrighty. Well, thank you guys for listening to us for another episode, and we'll be back next week. You guys have a happy Easter, and we'll see you next week.
Happy Easter.
Happy
Yeah,
Easter,
happy Easter.
everyone. Enjoy.